Hi, this is a mechanical shock or obstetric shock in shock series. Mechanical shock, also called as obstructive shock. The mechanical obstruction leads to shock which is preceded by acute loss of pulmonary vascular cross section area. Whenever there is acute loss of pulmonary cross section area, there is increase in preload of right ventricle. So when it happens, it may be because of direct obstruction, because of some mechanical obstruction, or vasoconstriction because of any reason. Whenever these two things happen, there will be increase in pulmonary vascular resistance, and ultimately it will cause right ventricular strain, right ventricular failure, and shock. So okay, there are four common obstructive shock. One, massive pulmonary embolism, air embolism, fat embolism, amniotic fluid embolism. Okay, so what is the pathophysiology of this obstetric shock? As already discussed, whenever there is obstruction or vasoconstriction because of any reason, there is increased pulmonary vascular resistance. This increased pulmonary vascular resistance causes these three things: right ventricular afterload, increase right ventricular dilatation, and right ventricular stress. Imagine there is right ventricle and it has outflow tract as a pulmonary arteries. So whenever there is block in pulmonary arteries, or uh, there is vasoconstriction, it will cause strain, increase strain on right ventricle. So there is increased right ventricular afterload. Right ventricular afterload increase causes increased right ventricular end diastolic and pressures and volumes. Then ultimately it will go to right atrium and it will cause reduced venous return. Whenever there is reduced venous return, means there is a decreased right ventricular preload. Ultimately there is right ventricular stroke volume is decreased. Okay, so next thing what will happen, there will be dilatation of right ventricle. The right ventricular septum may flat or it may be pushed to left ventricle. It will reduce size of left ventricle, or it will reduce the compliance of left ventricle. Ultimately there will be decreased preload and decreased cardiac output. Similarly, whenever there is right ventricular stress, what will it will cause decreased coronary perfusion, increased O2 demand. Both things will cause myocardial ischemia, and whenever there is myocardial ischemia, ultimately it will result in decreased left ventricular, right ventricular contractility, and decreased cardiac output. So this is vicious cycle. Ultimately, these three things will result in hypotension, decreased endocardial perfusion, and shock, which can be refractory and it may lead to death ultimately. So this is the pathophysiology of obstructive shock. So we'll see clinical features and risk factors of obstructive shock, which uh, we have already spoken about. So these are the four common obstructive shocks, and these have got risk factors and clinical presentation. So massive pulmonary embolism. So what are the risk factors for massive pulmonary embolism? These are the risk factors for massive pulmonary embolism: embolization, then surgery in last 3 months, malignancy, trauma, obesity, CVP lines, hypercoagulable states, or chronic heart disease. So how the pulmonary embolism presents? The pulmonary embolism presents with pleuritic chest pain, respiratory distress, cough, wheezing, occasional hemoptysis, hypoxemia, cyanosis, and fever. So pulmonary embolism. So specifically hemoptysis and fever can be there. Other type of shock is air embolism. So this is important in operation theater also. So risk factors are open surgical sites like craniotomy, LSCS. When patient is given a sitting position in craniotomy, heart is at lower level, there are chances of air embolism. So during laparoscopy, we use carbon dioxide. During endoscopy also, so it may cause embolism. Volume depletion causes negative pressure, barotrauma, pulmonary vasodilatation, biopsy of lung and airway may cause open tract and sucking of air, and it may cause pulmonary embolism, air embolism. Contrast injections, trauma. So how the pulmonary air embolism presents? Sorry. It may present as anxiety, sense of impending doom, chest pain, respiratory distress, wheezing, cyanosis and hypoxemia, gap gag reflex. Typical presentation, Millville murmur is there on auscultation by precordial stethoscope. If there is gas in arteries, it may present as agitation, delirium, and seizures. So these are the clinical features of air embolism. Other is fat embolism. So fat embolism this has got a syndromic presentation. So what are the risk factors of fat embolism? We'll see risk factors for fat embolism. These are the long bone fracture like femur fracture, pelvic fracture, orthopedic procedures, rib fractures, burns, acute pancreatitis, diabetes mellitus, sickle cell disease, liposuction, lipid infusions. So these are the clear causes. Even burns and acute pancreatitis also cause fat embolism. So how the fat embolism presents? So typical presentation of fat embolism includes potential hemorrhages on axilla and upper trunk, then fever with chills, chest pain. It also present like agitation, delirium, and seizures. Okay, so last one is amniotic fluid embolism. So this is related to obstetrics, and this has got syndromic presentation, and typically this is anaphylactic reaction to the amniotic fluid, which contains a lot of products, fetal products, and inflammatory mediators. So what are the risk factors for amniotic fluid embolism? Amniotic fluid embolism may occur in pregnancy, peripartum, postpartum till 48 hours, difficult labor, during amniocentesis, and during abortion in first and second trimester, and trauma. So these are the risk factors for amniotic fluid embolism. So how the amniotic fluid embolism presents? I already told this is nothing but anaphylactic reaction. So it will present like fever with chills, respiratory distress, nausea, vomiting, agitation, delirium, and seizures, wheezing, hypoxia, cyanosis. There are chances of coagulopathy and hemorrhage can be there during this amniotic fluid embolism. It may present at fetal bradycardia or late decelerations in fetus. So these are the four main obstetric shocks which have got clinical features and risk factors: massive pulmonarism, pulmonary embolism, air embolism, fat embolism, amniotic fluid embolism. Okay, thank you.